All right, well, if you buy your own health insurance, get ready to pay even more. Obamacare costs are set to be way higher next year, with insurance companies already submitting rate hikes to state regulators. Now, Trump has enacted a couple of changes so far, and they have actually made the cost of this a little bit worse. They've gotten rid of the individual mandate. And Rick, how big of an impact will this have on the average American who is paying for their health care individually?
Yeah, this affects one relatively small group of people, but it affects them in a very severe way. This is people who are not covered under an employer, so they buy insurance on the individual market, and they make too much to qualify for subsidies under the ACA, which is around $67,000. Those subsidies phase out at $67,000 for a couple, around $97,000 for a family of four. And there are around 7 million people who are in that market. They have to buy policies on their own, and they get no help. And what has been happening is to offset costs that are going up elsewhere that are controlled by the ACA or some rule here or there, the one place where insurance companies can just keep raising the premiums and people kind of have to pay it is on these people in the individual market. So three things are happening that Trump has put into place that are actually going to make this worse for this group of people. First, the individual mandate goes away beginning in 2019. And then Trump has proposed that two different types of what are called sort of skinny or temporary plans. People are allowed to buy these. These are much cheaper, but they don't cover a lot. So the only people who are going to do these three things, either buy one of these different types of plans or just go without insurance altogether, are going to be healthy people. That's going to leave sicker people in the insurance pool in the individual market. Because sicker people are going to be in the pool, premiums are going to have to go up by more than they would otherwise. If you get a subsidy under the ACA, the subsidy will cover most of that increase in premium. If you don't get a subsidy, going back to this pool of about 7 million people, you're stuck paying it yourself.
Dan, a Maryland regulator has said that the ACA is in, quote, a death spiral. Now, we've also gotten some other numbers here pertaining to the increase of cost. The Center for American Progress said that Trump's policies will add about $1,000 to unsubsidized annual premiums. That would be 16% above what the rates would have been if we didn't have these recent changes enacted by the Trump administration. I mean, what do you think the average American can do, or what do you think the solution is? Because there's just been so many problems, and so many people won't be able to afford the higher cost of health care now in this country.
Yeah, maybe the solution is a little bit of creative economics. You know, maybe you find a way to get your income down to that Obamacare eligible mandate so you can start getting some of the subsidies, which, as we talked about earlier, you and I, Rick, that caps a lot of spending. So people are spending, I think it's no more than 8% of their annual income on insurance costs. If you're out there buying insurance on your own, you're paying whatever the market dictates. And maybe we should stop calling this Obamacare and start calling this Trumpcare.
Well, it is Trumpcare.
Yeah.
It's a good point.
A number of the changes that he's put in are going to affect a lot of people. And, you've got to think about what are you going to do as a family when let's say you're making $100,000 a year, but you've got 2 or 3 kids, you've got, of course, the fixed payments, your house, your mortgage, your car, et cetera, and your insurance is just creeping up steadily. There's not a lot of options other than make more money.
There are people actually doing what you just described. I've interviewed a lot of people who are trying to, premiums for people can top $30,000 a year for a husband and wife. I mean, it's crazy. And they are doing things like this. They are actually working less so they earn less and so that they can qualify for a subsidy. This is very complicated. We could talk for hours about this. It's worth pointing out, Trump did not create this problem. This was a problem in the original version of the Affordable Care Act, kind of an unintended consequences. But we now have a very clear picture of what the problem is, and it can be fixed. There are ideas for how to fix this. You could raise the cap for subsidies. You could do reinsurance for insurers, which would actually, there are known fixes for this, and it's not even that hard from a policy perspective. Politically, it's impossible because the only thing the Republicans want to talk about is repealing Obamacare. They don't want to fix what's wrong with Obamacare.
And that would add more costs, wouldn't it, to the federal government?
Not much. Actually, not much. No. At a policy level, this is actually not that hard. This is why it's so infuriating, because there are proposals on the table. There are actually some legislation in Congress that would address parts of this, and they're just not doing anything about it.
Well, the point of it was to give access or give health care access to more Americans, and also to cut down on the number of people that are uninsured. Right. But in 2017, we had that number rise to 29.3 million people, and that number is expected to rise.
Yeah, it's ticking
up. So clearly,
it
there
will
are
rise.
A lot of changes.
It will go up for sure, because with the individual mandate gone, people are not going to have to buy insurance, and young, healthy people are going to say, I'd rather save the money.
Yeah,
exactly.
People between 26 and 30.
And then that's where the real problems could actually start to happen.